Okay, I'd like to call to order this meeting of the Anchorage Assembly Public Safety Committee. It is 11 o'clock on February 7th. Let's start with a roll call, please.
Member Brawley,
Here.
Member Bronga,
Here.
Member Constant, Member Cross, Member Johnson, here, Member Martinez,
Yeah.
Member Myers,
I'll say the excuse.
Yes, Mr. Chair, I am here, but I have to jump off at 11:30. Just want to let you know that I'll be gone then.
Member Presverdia,
Here.
Member Rivera,
Present.
Member Solt, Member Voland,
Here.
and Member Zaltel.
And just for the record, several members are excused today. Member Constant, Cross, Ballin, and Zalatil. Thank you. All right, so it looks like we have a good agenda today. Just a reminder, members on the phone, if you could send me a text if you'd like to get into the queue. And we're going to start with the Anchorage Police Department, if you guys want to come up. And are there PowerPoints for the screen, or is it just on paper today? Oh, there you go. Okay, great. Thanks. Okay, you have the floor, sir.
Morning, Mike Carl, Chief of Police. Sean Case is here also. We're actually not going to start with the PowerPoint first. We're going to cover body camera update. So as of today, we have 191 body cameras issued. 171 of those are on the street, and 20 of them are with our recruits. We continue to push the body cameras out there. We've been saying for a while that we received about 350 body cameras. So that, in fact, we have about 350 of them, but we only have 330 licenses. The additional 20 are spares. So those ones that when they break down, the officer will be able to go and grab them. But we only have licensing for 330. I just wanted to make sure that was clarified. With the 171, I have 45 officer vacancies right now. So obviously those won't get filled. Those will get filled during the academy. So if you add 191 and 45, we're well over the 200 mark. And with 330 being issued, we're well on pace to have full implementation to the people who have them, the officers who will be wearing them in short order. Any questions on body cameras?
Mr. Salt.
Yeah, could you just repeat those numbers that you just said in the beginning that were deployed?
So we have 191 issued. Of that, 20 are at the academy for our recruits. 171 are on the streets. I have 45 vacancies. So as we fill the academies, those officers will be issued body cameras. 330 total licenses. So that's how many, when I say licenses, that's licensing for the in-car video and the body cameras themselves, because we tie them together. And we have about 20 extra, so brings up to 350 total body cameras on hand, but only 330 licensed. And right now on patrol, I have roughly a little less than 170 officers. My authorized strength on patrol is 191 officers plus 22 sergeants. So that's actually, if I do all of patrol, if I include K9 and warrants, that's 208 people that we would consider patrol, but only patrol officers themselves, that's 191, and then 22 sergeants.
Okay. Ms. Brawley.
Yeah, thank you. On the topic of body cams, I wonder what is the department's kind of communication plan or public I guess, outreach or education on this. And so I'll bring up the ADN editorial, not because I'm arguing for what they are arguing, but just to note that I think I think we can all say there's been a lot of kind of public frustration or lack of understanding of what's going on. And so I appreciate that they're rolling out. And I know there's a lot of questions about, basically footage release and things like that. But what I'm wondering is, have you guys contemplated the idea of maybe doing a demonstration, putting out a video, but, not of a specific case, but kind of just really illustrating for the public what these look like, or what, that type of footage might look like, just as an example?
We did that already. We had invited the press to a demonstration. How many different press were there? So Channel 2 showed up. I think ADN was the other one. And then we're still looking at setting up demonstrations for the assembly. The problem is if we have more than 3 of you there at a time, it has to be open to the public. So we're trying to figure out how we're going to schedule 3 of you at a time to do demonstrations.
Sure. Yeah. And I guess I'm suggesting more, maybe some to work with your PIO to think about just kind of maybe putting a short video out there or something. Because I just know there's a lot of people are frustrated, but they're maybe not informed, right? And so maybe there's other ways to not having a necessarily an in-person demonstration for the general public, but just thinking about maybe short videos or something on social media, because I think that those can get out in the public more quickly. Because I think we all share the goal that we want to see these body cams work and really help people feel good about them. And so that's just an idea. Thanks.
Kenny, did you write that down? My video PIO is right there, so he'll get working on that.
So just a quick question about the infrastructure conversation we've had quite a bit, in terms of downloading the information, storage, access to it. What has been, where are we at in terms of the status of that? And do we have the adequate infrastructure, both from the police side and from your understanding from the law side is it working at this point, or are we in need of additional infrastructure?
We've had discussions with law, and both the district attorney and our office and the municipal prosecutor. I think it's more education. They were experiencing some difficulties, but everything is in that magical cloud in the sky where they can just get the information from. I think after my IT manager talked to the prosecutor's office, it was determined that it was more of a training aspect on the part of the municipal prosecutor's office. And once they worked out that, it shouldn't be too much of a burden on them. So I think there is infrastructure, but we'll have to talk, the law department's one who's actually going to have to address that.
Okay, but you have the adequate infrastructure, staff, resources to be able to manage the body cam issue from your side?
Well, we have yet to start dealing with the request for the actual footage.
Right.
So we'll see what that turns out. We have 2 people assigned for a video redaction, and we'll see how that works out. It's still in its infancy,
right,
so we haven't dealt with those concerns yet.
Okay. And you don't see any additional policy needs or changes coming up in the next year related to body cams?
Not at all.
Okay. All right. Thanks. It doesn't look like there's any other questions.
Okay, Travis, you ready? All right. So I haven't done statistics in a while, so I figured I'd cover the year-end stats. Plus, there's a lot of grumbling and concerns that crime is way up in Anchorage, and I just want to go over what we're looking like, what we're doing, and go over some MIT stuff, and just let you guys be aware. So this is what we're going to cover: annual calls for service, violent crime, property crimes. We're going to cover homicide, my drugs, crime prevention, what we're doing. Sean's going to deal with MIT. Then I'm just going to go over the total calls for service we had last year in 2022. And I'll show you the number of arrests for anyone who doesn't think we are working hard out there. Next slide. All right. So here's the violent crime stats. We have a 5-year span on there. So our trigger year, we usually compare everything. 2019 was like the year before COVID. And for some reason, the rest of the country blew apart in 2020 and 21. And we didn't. Our numbers were way down on everything. And we have a theory, and we're going to look at some data to see if our theory holds true. But we knew we'd see a spike in 2022, and 2023. We just didn't know how much it would be. So just for this year, you can see for the assaults are 0.2%. So we're still well below 2019. We grew a little bit from 2022. More people are out there. I think we're getting back to normal, and I think that's probably why. Sexual assaults were up about 4%. We've been historically high in sexual assaults here, where we do everything we can, and eventually the state and everyone, hopefully we can get the sexual assault numbers down, but they're still way down compared to 2019. And then you can see robbery, that's up 6%. Really no explanation, just more people are out there. Next one is the property and DUI crimes.
Chief, can I apologize just for a
Yep.
second? I just want to make sure we've had this conversation before, but just to clarity, these are calls.
No, these are calls for service.
Is it, so someone has called you for this, or is this a verified assault, a verified sexual assault, robbery? That's one question. Is this somebody who's calling to report this, or is this you responding to it?
These
because
are calls that we actually classify as these. So
Okay.
at the end of the day, they're classified as assaults, DUIs, sexual
So
assault.
this is not someone reporting it. This is actually you responding to it.
Yes.
Okay. Thank you.
So now we're at property crimes. I think this is where we've seen in theft. We saw a drastic increase in, I think we had large encampments this year all over the city, and there was a lot of theft associated with a lot of the encampments. And I think this shows it. This was the first year last year that we've ever had these encampments all over the city in almost every green space. And I think this reflects it. And this and a couple other things for the best. This is the most startling one, that thefts are up 16%. So we're trying to deal with it. I'll go over our strategies later on. Go to DUIs. DUIs are up slightly. They're up 3%. More people are out there enjoying themselves at the bars, and unfortunately, they're not using designated drivers. Burglaries, they're down 17%. So we've done some things in detectives. The property crimes units have really get out there. They've dealt with some cases where prolific burglars, criminals, and it shows that they've had an effect on the burglaries across the city. You can see stolen vehicles are up 6%. We can contribute this to the Instagram and Twitter and all these things. We did deal with the Kias and Hyundais. I think everyone knows about those, where it's about as easy as picking up this piece of paper as it is to steal one of those cars. And I think there's a nationwide effort for that company to actually do something about it.
Okay. I have a question for you, sir. Ms. Brawley?
Yeah, thank you. First, this is great to see these numbers either trending down or flat. So I appreciate that you're providing real data and not just the narrative that crime is always increasing forever. But I do have two questions. First, can you describe the difference between burglary and theft? Because I see theft is technically up from last year, burglary is down, but I know those are two different things. And then my other question is with DUIs. I know often police departments get grants, or you guys work with state troopers on extra checks, sobriety checks and things like that during holidays, or, there's extra money out there. So can you just comment on, what those activities have been? Thanks.
So I would love to do roadblocks and sobriety checks. We don't do those here, but we have extensive grant money where we're doing overtime details for DUI specific things, especially on the big holidays. 4th of July, we do them. New Year's Eve, we do them. Memorial Day, we do them. We also have the highway grants where we do highway enforcement, and part of that is looking for DUIs. The difference between a theft and a burglary is from a dwelling or a building, and a theft wouldn't be. So if someone breaks into your house, that's a burglary. And if they steal something, in addition to the burglary, that's also a theft. Or a shoplifting is a theft. Theft from a person, if you use force, is a robbery. So there's actually some big differences there. But the big difference between burglary and theft is the burglary has to be from a dwelling or a building.
Okay, thank you.
Mr. Johnson?
Yeah, thanks. I just wanted to highlight a little bit more just how significant this decrease in burglary seems to be. And you mentioned that you think this is in large part due to a special unit that's been focused on investigating burglaries. Did I hear that correctly?
Just a different approach to how they dealt with it. we had we have little groups they're prolific, and once we identify that, use data to tie them together and be able, once we can isolate those people and actually tie them to 60 burglaries, which we have done. I won't say 60 is the number, but several burglaries that we've done. It's once we identify those people, you can see the numbers drastically decrease. That's the stolen vehicles the same way. You could see a huge decline at one point. If you've seen the numbers many years ago, we were up in the 3,000 stolen vehicle. We changed our approach to how we dealt with that. And I'm not going to say how we do it because I don't want the bad guys to know that. But and we still carry that approach on today, where we're able to curtail the same groups of people from going out there and committing burglaries or stolen vehicles.
Well,
Just different strategies.
I'll just say kudos. I mean, having worked as a patrol officer before, I mean, burglaries it's a pretty traumatic event for a family, and it's not just the goods taken. There's often a lot of damage to your property. There's a sense of violation, and they're not always easy crimes to go out and investigate and then actually make arrests out of those. So just good job on that, because that's pretty meaningful right there.
And then the vandalisms, as you can see, that's down 2%. Next, so this is the one the next one is the homicides. So homicides were down 18% last year. And I think that's a pretty impressive number. I'm not going to take any credit for it. It's just one of those, it's nice to see those numbers trending down. Last year was a little anomaly. And I think I actually said here, a lot of the homicides last year were strange, where multiple people, suicide. There were a lot of domestic violence ones where 2 or 3 people were killed and then a person committed suicide. But the numbers trending down here from 28 to 23, an 18% drop in homicide is always good to see. Okay, I'm going to go over so one of the things I'm going to cover later and why we think one of the effects we're having. So HIDA, that's a high intensity drug trafficking area. We are linked up with the federal and state partners, and it's a statewide approach to focusing on drug trafficking. And with the fentanyl epidemic, we actually reorganized a little bit. We put the people who like working with drugs in the drug unit. We put a supervisor and a commander in there that had the knowledge to deal with it. And they've been there in the 2 years since I've been chief. And I'm going to cover the last 2 years, what the HIDA in our drug unit has done. So Travis, next slide. Nope, it went too far. Oh, there you go. So these are the 2022 and 2023. These are just the seizures that we've done from cases we involved. If you guys saw the U.S. Attorney's press conference 2 weeks ago, talked about the Highland case, the Housewives of Highland, where over 50 defendants were arrested in this whole thing. That started from a case in Anchorage, where our people in our drug unit, our HIDA unit, put together this whole thing. And it was just people in prison in California, drugs coming up from Mexico, murders in Trapper Creek. Everything was tied together, and just the drugs alone and the money and the guns that were seized. It was impressive. And that's what our guys are concentrating on. They're out there. They like doing what they're doing. And as you can see, they're pretty good at getting some of the drugs off the street. And part of the HIDA is also airport interdiction. That's a different HIDA, but it's all part of the statewide HIDA program. We actually have task force officers assigned there as well. So we have people involved in the drug trafficking area. We know most of it's going to come through Anchorage. It's either going to come through the port or through the airport. And we want to interdict it here before it gets to the rest of the state. So we're doing a pretty good job. And you can see just the arrests, 43 last year, 60 this year. And then the next ones are just so you guys can ooh and ah at what the drugs and guns and money look like. This is part of a couple of the cases. If there's drugs, there's guns. And we know that. And there's always money there. There's also a lot of pornography associated with drugs too, but I didn't want to litter the screen with that. So
Chief, what's the top left? What is that large white block?
that's cocaine.
Oh, that's okay.
And then the next slide, just more of the same thing. Just these are the kind of seizures we're doing. We seized more fentanyl pills last year. It's just insane.
Mr. Salt? question.
So I think kudos, but so you show, I guess, volumes or pounds of drugs taken. Are we seeing a rise or is it remaining steady overall?
Well, our interdiction efforts have increased. So whenever you increase, the last 2 years especially, the state has come on board. They realize the benefit. The United States Postal Service is on board. All the federal agencies are on board. So interdiction, we've increased it. Whenever you increase interdiction, you're going to intercept more. And I think that's why the past 2 years we've seen this, because we've realized that, well, and fentanyl is probably the reason, because fentanyl is, I mean, it kills. And I think we recognize that, the states recognize that, the feds recognize that, and it's like, we need to start interdicting this stuff. It'd be nice if we could do more at our southern border to prevent it from getting here. But until we do, all we can do is focus on interdiction. And I think our interdictions are proving worth. Now, we're not getting it all, for sure. There's a lot that's making it through, but at least we're putting a dent in it. Okay, so I covered, next slide, Travis. So people always say, well, what are you guys doing about crime? So I just wanted to cover a few things. This is not at all everything we're doing. So we do use hotspot policing, and that's our intel unit. We use data to allocate resources. I have an example of a heat map coming up, what a heat map looks like and how we utilize heat maps. But we utilize the heat maps for suppression details and directed assignments by patrol. So we know when and where the crimes are occurring. The large amount of crimes are happening. So we put resources there to either prevent or be there when the crime is happening. CPTED, we go out to businesses or homeowners. That's crime prevention through environmental design, and just try to point out, hey, your house or your business is very conducive to criminal behavior. Try putting up some lights, some camera, cut back the shrubbery, make it so it's not attractive. And a lot of times that is enough to prevent crime at that one location. I just covered the drug emphasis. I think it was pretty evident that that's working. We've made some enhancements in the crime lab. NIBIN, that's where we do shell casings and we try to tie crimes together. A lot of times you can get shell casings at different crime scenes and tie those together, and then you can bring it back and you realize it's the same people committing the crime. We have rapid DNA now, which as long as their DNA is on file, we have the ability to get out there and analyze the DNA quickly. Recover is another new tool we're using, and basically that deals with latent fingerprints. It allows us to get better quality prints from the scenes of crime. Next thing, like I've mentioned earlier, we have detective involvement in cases earlier, and that's the key. The earlier we can get detectives involved, the better the chances are that we're going to solve it in the long run. And they can also, the interaction with detectives, even if you're in the property crimes or violent crimes, they get together, they talk. A lot of these crimes are associated, and they can say, hey, that guy is associated with this crime, and we can tie the crimes together that way. So that's an important role. We do crime suppression operations, warrant roundups all the time, traffic enforcement, drug operations, the investigative support unit. We put that together a couple years ago. Basically, that's they're my unit that go out after the most violent and most prolific offenders. They go after the worst of the worst in the city. And just last year alone, you can see they made 131 warrant arrests, 166 new charges, agency assist, not only for detectives, but for other state and federal agencies. They did 107 assists, did 19 warrants, seized 10 firearms. And basically, these guys go out there and put their lives in the line every day dealing with the worst of the worst people here in the city. And they're pretty good at doing what they do. And then again, community policing is a big part of what we do. We engage the community in the community organizations. We partner with downtown businesses to address trespassing and safety issues. The Foot Patrol, which we're doing full-time now, that one of the things they do, we make sure they get in there, talk to the businesses, address the concerns they have, and hopefully we can enhance the downtown area. I want to highlight, we worked with the Gaslight. Part of a hotspot, we saw a lot of crime happens at the Gaslight and the Pioneer, right in that area during bar break. So We partnered with the gas site to address those issues. We've done some things. We've closed off the back parking lot. Luckily, we own the parking lot, so we can close it down as soon as bar breaks. We can get them out of there. There's some other things we want to do. Food sales are a big thing. Everyone's lined up for one hot dog stand, and they're drunk and they want a hot dog before the other guy, and fights break out. We would like if we could get those hot dog stands out of there. And we're making other recommendations, but the gas site's working with us, and a lot of the businesses work with us. We have a great relationship with them to address not only nuisance crimes, but actual violent crime.
Ms. Brawley?
Yeah, thanks for bringing up the bar break hours. So this is something that I've started talking with some folks from the industry, not to get rid of that program, but just kind of the permit aspect of it. Because is there a way that we could streamline it basically and still keep the intent? So I just wondered, do you happen to know, does the Gaslight or the Pioneer, do they have those bar break permits or bar safety hour permits? Or because I know some businesses have them, other ones don't need to have the permit, but they can still engage in those activities, just if you're aware.
I believe the Gaslight does have it. The Gaslight, they're the biggest. Everyone goes to the Gaslight. Pioneer is kind of separate, but most of the problems arise from both those bars get out at the same time. They all linger in the parking lot. We've addressed that issue. We've seen a decrease in activity there, which is great. We're going to address the other issue, but I do believe that I know the Gaslight has one. I'm going to say 99% sure.
Thanks. Yeah. And not to get into that today, but just to know, I'll follow up with you guys. But like I said, we're working on, maybe we can streamline the code, but certainly not get rid of the intent or the safety aspects of that. So thanks.
And then we do retail blitz operations to deal with shoplifting and other crimes. I can tell you, I received a accommodation from the REI head branch. They saw what we were doing here, how we dealt with a crime that was occurring at REI. I think over 200, they saw a reduction in over 200,000 loss in a year when we worked with them with the retail blitzes, SEPTED, and they were appreciative. They actually want to take our model and put it across all their stores in the lower 40. I'm not sure how many they have, but I think there's a couple in Washington and Portland. We also, part of the community policing, is, if you didn't know, one of our sergeants, John Butler, won the Swicket Chevrolet truck for the hometown hero. And that's mainly because of what he does as a police officer, getting involved in the community. I mean, we do RACT, which is, I can tell you, Deputy Chief Case myself, we go out every once in a while. We'll go to we went to Sears, the cars at the old Sears Mall, and you just see people that come through and say, we appreciate you and we want to buy your groceries for you. And we do that all over the city. It's part of the RAC program by Anchorage Cost for Community. Shop with a Cop. We do that. Coffee with a Cop, Citizens Academy, Angel Tree, AC4C. We're out there in the community just showing there's a name and a face behind the badge. And unfortunately, the police get a bad rep sometimes. We want to show you, hey, we are human too. And that's how we get out there in the community. So those are a few of the things we're doing. And we do this to improve community relations and hopefully reduce crime. And I think it's working. Next. So this is what a hotspot, this is what we do. So every 2 weeks, we do an analysis of reported crimes. And this is what's important. A lot of times I hear this from people all the time, which just frustrates me. It's like, well, I didn't report that crime. And it's like, well, we can't take action if you don't report it. And as you can see, we put grid numbers around you can see what the hotspots are. They're orange and yellow, and it's pretty significant when you can see a concentration of crimes. And we take that information, and the officers have this, detectives have this, and our intel unit also, next slide, Travis. Our intel unit also has this is what they do with it. They tell the patrol guys, hey, this is where you should be, when you should be there, and they have access to these maps. So our intel unit provides this. You can see it's broken down by shift. I guess nothing bad happens on days, but on mids and swings, it tells them what the map page is, what the beat is, the time, and the days of the week. And this is just part of the proactive policing that we do. I thought this might be interesting to you guys and actually see what a hotspot map looked like. All right, Sean's going to give me a breather here, and Sean's going to cover the next 3 slides.
MIT, if you look at our mobile intervention team, the 2 graphs I have up there, top one is, just so everyone's reminded, we came online the end of June. So that top graph represents the calls that they take, the calls for service. The bottom graph represents the mental health related calls that patrol takes. And so you can see with the addition of them in June, if you follow that down to the lower graph, that it's decreased the calls for service that patrol is taking, which is one of the goals. So look at the next slide. This is the month of December. So the department takes in generally over 1,500 calls for service a month that have some mental health nexus to it. In December, we did 1,639. You break that down a step, patrol handled 972 of those, and our MIT teams did 263. In addition to those 263 calls, they did 144 follow-ups. The importance of the follow-up is that generally keeps some of our high utilizers from having multiple 911 calls. So those follow-ups are pretty critical at keeping the calls for service down in the long runs. And those range from simple phone calls to actually making follow-up contacts with them. If we go to the next slide, I'll point out the graph first and then the 2 squared boxes. The graph is just the hours in volume of calls that come in. As you can see on the far left where it's low in terms of the call volume, those are the hours that we don't have coverage. So we're just showing that we deploy based on when the calls for service come in, which again, that's 7 in the morning until 1 in the morning. The square to the left, 35.6, so that represents is when MIT is working, they're handling 1/3 of all the mental health related calls that come into the police department. So that's generally one team that's on at a time. So if you think of the slide before this, where we have over 1,500 of these calls that come in a month, and MIT's taken 1/3 of them while they're on. I think that directly shows that we're doing what we accomplished, is we're pulling those calls for service out of patrol, and we're putting with a specialized team. In conjunction with that 35.6, our top 50 utilizers in terms of calls for service, patrol only handles 9% of those, and MIT handles 28% of those calls. So again, those calls are usually more involved. They're a little bit more complicated, and we're taking those calls out of the rotation for patrol and putting them in to the MIT rotation. And incidentally, we're also passing those off to MCT as well. So kind of both teams are helping with those high utilizer calls. The last box I'll cover is the lower right-hand corner. When you think about what the extent to the problem is, or the issue or the challenge that we have here in Anchorage when it comes to mental health, the fourth quarter of last year, we had 1,835 unique individuals when it comes to contacting the police department in crisis. 549 of those are duplicates, at least 2 or more. That's a lot of people. So when we say the top 50 utilizers, just understand that 549 are duplicate or more. So it's not just that we have 50 high utilizers and the rest is very low volume. We have a lot of folks in our community that require services. And of those 549, the average calls for service is 4.76 in that period of time. So you were talking
Per what? Like how often? 4.7
for that quarter.
For that quarter.
So of those 549 that are duplicate, the average call is 4.76 in that quarter. So they're basically, those duplicates are calling it five times a quarter. Yeah, kind of makes you scratch your head a little bit, huh?
Any questions on MIT before we move on? All right, I just wanted to, like I said, this is a year-end summary. This is the total calls for service for the Anchorage Police Department. Those are just the top 30 calls on the right, but our total calls, I just thought it'd be interesting. So last year we had 386,343 calls for service. It's a little more, it's less than a 1% increase from 2022, but we did go up a little bit, and you can see our top 30 calls are over there. If you want to look in more depth at what kind of calls we're responding to. Again, those are in top 30. If I listed all the calls, I'd have like 10 pages of different calls. So I just wanted to highlight the top 30. Next call, next slide. So this is the final slide. The men and women of the Anchorage Police Department, we're really good at doing our job. And part of our job is arresting people. Last year, we arrested 9,107 individuals. We're busy. And the guys and girls are doing a fantastic job. And I just wanted to highlight that anyone who thinks, if they're wondering why it sometimes takes longer to get the calls, well, we are really busy and we're dealing with some serious crime. And that sums up. Any questions on the last two slides?
Yes, Ms. Brawley?
Yeah, just a, thanks for the data. Just a brief comment. I'm looking not at the arrests, but at the calls for service, and it strikes me how many of them really have, as you said, a mental health component. So even things like disturbance, there was mental person, suicide attempt, medic assist, things that are medical or mental health in nature. So I think it really just emphasizes how much we currently, because of the limitations of our other options, rely on the police to deal with things that are really health issues. And I understand there's a safety component, but thank you for highlighting that.
And that's a perfect segue. Limitations on assets available. Let's talk about our winter response, because that is your last sentence is
I got one more for you
Okay.
before we move on. Sorry. Well, just actually two. In the very beginning, you mentioned you have 45 vacancies. The 45 vacancies in patrol, is that where those are?
actually in patrol. Let me find that sheet. That's sworn across the board.
Across the board. Okay. Okay.
Yeah,
Um,
patrol, I'm authorized 191 officers on patrol, and I'm a little under 170. So, and that's just the officers, not sergeants.
Yeah.
So that's a little bit less than 30
Okay.
vacancy on patrol.
Okay, so still short on folks. That's
Yes.
still a theme. Okay, and then just one thing that stood out to me on this arrest offenses is this whole section on prostitution is 0,000, and everything else is significant. Can you speak to that? Is that not an area in our city that there's as much concern, or is that not a focus of yours?
It's how do I give a good political answer? It is an issue. It's hard to prosecute. What happened several years ago, prostitution, the prostitutes themselves, oftentimes they are actually victims.
Mhm.
And a lot of times when you arrest prostitutes, you're re-victimizing the victims. And we were given guidance a few years ago that until we get some changes done in the system, that it's not really a priority. And a lot of the prostitution now is done online. And as anyone who's been here for a while remembers, the prostitutes lined up on Spenard or in Mountain View. You don't see that anymore. A lot of it's behind the scenes, and it is not a focus for us right now.
Okay, great. Thanks. I just want to clarify because it was a standout in the sheet. So
Okay, so Kevin Cross wanted us to talk about emergency shelter. And I think talk about limited resources. We opened up cold weather sheltering, 3 different locations because the weather was really cold. And before we did that, the weather was still cold, and the weather is still cold today. We still have a solid waste service location that still takes as a warming shelter, but that's going to close down pretty soon. And what it does, it leaves the Anchorage Police Department and the fire department in a pretty big predicament. We have no place to bring people when it's cold out. And we can talk about sleep off. Sleep off only takes people if they're incapacitated, which is a pretty high threshold. So we can have people who are inebriated that aren't incapacitated that we have no place to bring. Our officers, this is just an email from one of our officers to all the other officers, desperate to find a place to bring people because we're concerned about the citizens. And when it's cold, let's face it, 10 degrees is still cold when you're sleeping on the sidewalk. And before we opened the shelter, we had no place to do it. This is what we're trying to shelter at East 56. It was full almost to capacity and we couldn't bring them there. We couldn't bring them there after 11 o'clock anyway. The sleep off center, again, if they're not intoxicated, they don't go there. If they're not incapacitated, they don't go there. The Tudor Rescue Mission, they get full really quick and they only take people if they haven't been drinking. The Hope Soup Kitchen, that's women only. And again, they have to be sober. What we do is we call churches to see if they have spaces. A lot of churches do open their doors, but the officers spend a lot of time trying to bring these people to hopefully prevent them from suffering serious injury or death. We can do a Title 47 if they're a threat to themselves. A lot of times we'll call the medics and say, hey, this is a medical condition. This guy's, can you look at him? And then we just handing off the problem because they have no place to bring him either. So what we end up doing is they warm up in the police cars or in the ambulance or somewhere because we just have no place to bring people when it's cold. And it's, I don't know what the answer is. Until we have I know everyone is working hard on housing people. To me, from the police perspective, if we had a low barrier shelter that was big enough to house all the unhoused people and then worked on housing them from the shelter and then scale down the shelter, that would be an option. And it would give us the option of bringing people to places. We don't have that option now. And right now we have officers tied up for hours on end trying to find places to bring people. And eventually it's like, are you warm now? If they're warm enough, it's like, give them an extra blanket and hopefully they can find a place that's warm, or hand them off to the fire department or take them to the emergency room. And then they're tying up the emergency room. We're in a predicament. We're doing the best we can. We care about the citizens, but if we don't have the tools available to us, I would just hate to think that people are getting neglected because there's no place to bring them.
Mr. Soul.
Thank you. So it may just be the way you're talking about the situation. So I would assume if your officers, is there any kind of central resource that's trying to find this space, or is each officer individually trying to make these calls, or can they just call a hotline and say, hey, there's one space here, one space there?
It's an individual, especially during mid-shift hours when it's the coldest. I mean, most of the places they're calling around on their own.
So that might be something maybe ACH, Coalition and Homelessness, could set up, to know where that space is. So when your officer has a need, it's one call.
There is,
available or not.
well, there is the dashboard that the officers, most of them probably don't know how to get there. We know how to get to the dashboard and we can look at it every day, especially now it's just full. Thank God that the solid waste service location is still taking people, because it still gets cold at nighttime. And I mean, minus 20 was cold, minus 10 is cold, 0's cold, 10's cold. When it's damp and snowy, 20 is really cold. So, and if it's windy, the thing is, our hands, we don't have the tools available because there aren't resources out there.
All right. Thanks. I'm just recalling the last time I did a ride along, this exact thing happened. We picked the person I was with picked up somebody and there was no place to take them. So, okay. Any additional questions? Is there anything else?
No,
Okay. Thanks so much for your information, your presentation. We really appreciate it.
thank you.
Okay. I think we are ready for the Anchorage Fire Department to come up and thank you all for being here. If you could all start with just introducing yourselves for the record and then go ahead and start.
Good morning. Eric Shinneman, Deputy Chief, Fire Department. I'm acting for Chief Schrage, who's out of town this week. And I'll let my staff introduce themselves.
Good morning, Jennifer Pierce. I'm the lead clinician with the mobile crisis team.
And Ben Lewis, I'm one of the assistant chiefs at the Anchorage Fire Department.
Travis, next slide. So we'll start off with just kind of a general overview, and our statistics presentation is more of a high level versus down in the details. But for today, we just kind of pulled the last 3 years from 2021 through 23. Going back the last decade, 2 decades, typically AFD has seen a 3 to 7% increase each year on our total incidents. Primary driver is, of course, our medical request for medical service. The one kind of off year was actually the first year of the pandemic in 2020. We were actually pretty neutral on an increase or decrease on call volume, but the last few years it has been increasing about 5 to 7%. The incidence, this is based on just our records management system. So each call for service is given an incident number, whether it's fire, EMS, or a call for assistance. Before we move on to the next slide, the AFD dispatch, as you know, we do handle all the calls and requests for the ASP vans. What we have seen has been a steady decrease in the amount of dispatches we're doing for the ASP vans per year. Going back to 21, you see 17,000, and it's down to 13 this year. And I think that's been kind of consistent with the numbers that AHD has been reporting as well from ASP and ASC.
Yes. Oh, Mr. Johnson, sorry.
Yeah, just looking at ASP, that's interesting. Does that have anything to do with changes in the availability of ASP as a resource, or is it actually, I'm seeing an odd there, so maybe I can pause, and is that why we're seeing that number go down? I'm wondering, is it because of resources, or is it because we actually think there are less people who would be demanding ASP services?
Probably a little bit of both. ASP last year, I don't know if you're familiar with some of the complications we had with the contract that ended up being terminated, but yeah, there were days available and times available were much more limited in 22 and some of 23. So hopefully 2024 will have a full year and we'll see a decrease at the same time.
Thanks. Mr. Gates?
Thank you. Could you just remind us what the area for ASP service is?
They cover more or less everything north of about, this is south of Tudor. I can't remember exactly. So the cold weather facility is actually outside of their initial service area right now, which is really unfortunate. I don't recall the exact line. It's somewhere just south of Tudor though, and everything north.
Thanks. I was trying to remember if we enlarged the service area a few years ago or not. I remember there was some dialogue about doing so.
Over the past 5 years, I think there were some minor tweaks, I'll call it, to the service area, but it was more on the east-west side versus being south of Tudor.
Thanks.
Next slide, Travis. So looking at kind of this is specifically with our fire incidents for the past 3 years. And again, as you can see up there, obviously with the way the summers have been, our wildland outdoor fires have been pretty steady. I don't really have a breakdown on specifically what might be a campfire versus brush fire. But trend-wise, they've been staying steady for the last 3 years, last 5 years. Our structure fires have been up, especially this past year, but there isn't anything specifically I can report, like one causation that has increased. I think it's just our numbers in total have been up, and it kind of goes up and down over the years too with our structure fires. Travis, next slide. So our medical incidents, and as I mentioned, these are the ones that are primary drivers of service for the fire department. We have, and Chief Lewis can speak to this more, but in the past couple of years, the amount of our transports has been increasing steadily. So the medical incidents include calls for service where we arrive on location. We may assess an individual, but a transport is not required. But we're seeing over the years an increasing number of transports as well to our facilities. One thing that I do more of a deeper dive into, like our substances of abuse, and I don't particularly have a slide for this one, but as the police chief mentioned, we have been seeing a steady increase probably in the last 2 quarters of 2023 of our use of naloxone by our paramedics and EMTs for suspected or known opioid overdoses. What is interesting is also track other documented drugs of abuse like methamphetamines, which has really been, at least from the medical side, what we've been seeing most of is in the past years is with methamphetamines. What I did notice in this last quarter, and I'm just finalizing last year's review, is a pretty substantial change in what I'm reading in our reports of. We're responding on more calls that were typically stimulant overdoses, and they're now including opioids. So the fentanyl has just kind of creeped into the cocaine and methamphetamine that's being sold out there. So we're seeing a lot more use by our personnel of naloxone, as well as the Project Hope kits. The public access Narcan is becoming more and more prevalent in the community. So I'm seeing more uses by APD officers, ASP, and all sorts of just public and private entities as well as using it, which is good. What we just don't know is how many are not entering the 911 system that Narcan may have been used on. But on the positive note, and clinician Pierce will talk more about the MCT statistics, is since 2015, looking at the drivers of our EMS responses for psychiatric emergencies, can't say it's a good trend yet because I only have 1 year, but in 2023, our medics were responding on less psychiatric emergencies for the first time. And I will just go out and say that is in no small part due to MCT and MIT over at APD, just diverting those calls from our first responders. Yeah, next slide. The non-emergent incident types, and these cover a broad range of requests for service. Good intent calls could be just smoke in the area calls, just anything that might activate a 911 call that's shifted over to fire and EMS. Service calls and false alarm calls kind of range in similar motions of whether it's fire detection systems, water flow issues with like water alarms and sprinkler systems. These are kind of typical what they usually average for the amount of calls we receive over the year. There isn't any specific trends over the past 5-10 years I can speak to, just coming from previous experience on this. And these also includes calls for services that there was like no patient found on location. And correct me on this one, Ben, these may be where ASP interacts with us too, would be in these calls.
Those usually would end up as medical calls if ASP requested this.
So, Travis, next slide. Okay. I will pass it over to clinician Pierce.
Days available last year were 342. So in 2023, we only had 2 clinicians, myself and 1 other. And so we were available 342 days last year, which is great. Total responses is 3,634. And then we broke it down into 911 crisis calls and then our post-crisis follow-up. We do acknowledge that we need to be doing more follow-up. It's just very difficult with only 2 of us and our crisis calls being so high at this time. Our average time response is 35 minutes. So we are staying below that hour, which was our goal at this time. And our average time on scene is about 24 minutes. So sometimes we have individuals who know us pretty well and we know them pretty well. So we're able to keep our times pretty short. I think the longest call I've been on though is 3 hours. So there's definitely a wide range in there for how long it takes. And then our post-crisis is usually about 12 minutes. Sometimes those are over the phone or they're in-person visits as well. Next slide. Individual served. So over 2023, we saw 990 unique individuals all across the municipality of Anchorage, Eklutna to Girdwood, and all different places around the community. We're really proud of our data of 90% of those contacts stayed in the community. Crisis now has a goal for mobile crisis teams to be at 70%. So we're really proud of that statistic of being at 90.
Mr. Johnson.
Yeah, so just to make sure I'm doing the math right, if I look at the outcomes and add it up, it's about 3,000 outcomes and 990 individuals served. So you're seeing, sounds like your average person 3 times. Is that right?
Yeah. Yes, absolutely. And then transported by AFD. So a lot of times we actually help our line out too and try to motivate people to go to the hospital who need to go to the hospital. And the transported by APD, we work really closely with our MIT as well about how do we create the best transport and how is this going to be safely done. So sometimes people actually request APD because they don't have to be charged for the ambulance or APD is there faster. So we work together and collaborate to find the best path to get to the hospital or a safe location. Also want to mark on housed versus unhoused. We saw 764 unique individuals that were housed and 226. So while we do respond to individuals who struggle with homelessness, we also really focus on those who are housed as well.
Great. Mr. Soul?
Just want to be clear, when you say housed,
Mhm.
you mean housed on their own versus being in one of our shelters or one of the hotels?
Correct.
Okay.
Yeah. So housed would be in assisted living, their own apartment, living with a family. Yes. Yes. We also do a consumer satisfaction survey. So while we can show data that we think we're doing well, we also want to know how we are doing with the individuals we're interacting with. So we have our administrative assistant call individuals who are over the age of 18 and do not have a legal guardian. And 87 surveys were completed last year. And we asked them just simply, are you satisfied? Did we treat you with respect? And were we helpful? And you can see an astounding number have said that. And we also do have some great quotes that they tell us, they were helpful. We really appreciated it. People enjoyed staying home instead of rather having to go to the hospital.
Yes. Ms. Brawley?
Yeah, thank you. I just wanted to say these are great statistics, and I really appreciate that you guys had provided this as a written report prior. So thanks for reiterating this. And also just to note, it's really interesting, this 90% staying in the community, that's literally the same statistic that other Crisis Now model programs have shown, that 9 out of 10 calls usually sometimes don't even need a call out, but really don't result in, as you said, going to another facility. So it's great that our program seems to be following, as I would have expected, right? Following the model that we put forward. Thanks.
We're very excited. We have 2 new mental health clinicians that were just hired, and we're working on completing their onboarding at this time. It was a very competitive process. We had a lot of applicants, and they were all really strong applicants. So I'm very excited that we are able to recruit that level of professionalism to the Anchorage Fire Department. We are expanding our hours just this week now. So we are 12 hours per day, 9 a.m. to 9 p.m. And then we're going to be trialing a 24-hour period. We're going to be doing 3 shifts. We're looking at the data to be able to determine which 3 shifts of the day, days of the week that we're going to be most effective and efficient at. And we're going to trial it for 3 months to determine if going 24/7 is going to be efficient. And also, we don't want to burn anyone out as well because of our high call volume in Anchorage.
So the 2 additional staff, so that brings you up to 4?
Yes.
Is that right? Okay, thank you.
And then lastly, just kind of a building collapse and cold weather update from the fire department. The top bullet point has changed. We're now up to 10 roof collapses as of this morning that AFD has been notified and responded to. All of these have been commercial occupancies. Some are currently being used, others are unoccupied and have been as such. And this year we've had no injuries. And of all the 10 since December, I believe there was only one that was actually an occupant in, and they were able to self-extricate.
Just for the public, are those, because I think there is a fair amount of concern from the public around making sure they clear their own roofs, their own homes, those kind of things. Are those primarily flat roofs, or have you seen both?
There was one over the weekend that was more like a lean-to structure, but it was still a commercial. Every of these 10 that I was able to review, they were all flat.
Thanks, Mr. Salt, and then Mr. Johnson.
Ask a few questions you might not know the answers to, but I know last year a lot of the roof collapse were due to design or construction issues. If you have any information on that, also any information on what kind of snow loading that we're seeing and where these are collapsing. Is there a map or anything like that?
No, the particular ones that I reference, I believe they've been all about Midtown to North Anchorage. They seem to be older construction. Again, they're more the larger warehouse or workshop types with large flat roofs. I have not found anything that we've responded on that's been residential in nature. But snow load and construction design, I'm sorry, I can't answer that one.
Thanks. Mr. Johnson, did you have a question? Okay, thank you. Go ahead.
With the cold weather shelters, and Chief Lewis did some research for me, and since the emergency declaration went into effect, we've had 36 documented transports of individuals to any of the 3 shelters, and that was through Monday. But this was primarily done by ambulances, and correct me, Ben, these actually came through 911.
Yeah, all of these came through 911 dispatch.
Other parts of the AFD that's been affected by this, Travis, can you go forward on? Thank you. There has been reported just with this extended period of -10, -20 degree temperatures. Obviously, that does have an effect on our vehicles. So there has been reported just increased maintenance requirements. Our fire response, actually for January, we're still kind of compiling that one. For the depth and length of our cold weather hasn't been extraordinarily high. The number of structure fires we've seen, they're kind of the more the typical ones for a cold time of year, just heat tape and or with chimneys. There have been several instances, and again, it's not uncommon in very, very cold weather, is that on our fire engines, the pumps will actually start freezing up a bit. And it's easily remedied. We just have to take them back to the station and thaw them out. But we've had no failures of equipment reported, which is good. It's just been a little bit higher maintenance requirements by our mechanics. And the other thing to note is just over the past weekend, actually, is from February 2nd into February 3rd, is we did move AFD dispatch to our alternate facility at the EOC. There was some concern made by M&O on Fire Station 12, as you're aware, is one part of the station is a fire station. The other part is 2-story, houses our data systems group on the top floor and our dispatch center on the bottom floor. So that's on the south side of the fire station. The snow load was on the roof was concerning enough that M&O kind of pushed us forward to get our roof shoveled off, but just an abundance of caution, we did move them to the EOC. Further follow-up by a structural engineer did determine that, and believe it or not, that structure was actually over-designed, so it could easily have handled the snow load on it, but better safe than sorry, so we just had to temporarily move them down to the EOC.
Great. It doesn't look like we have any questions. Thank you. Thank you so much, all of you. Appreciate the information. Okay, next, do we have a representative from the Department of Law who's here? I don't know if we have anybody today. All right, we'll make sure to follow up with them. All right. Office of Emergency Management, come on up. Thanks. If you can give your name for the record and go ahead and start when you're ready.
Good afternoon. My name's Amanda Loach. I'm the director at the Office of Emergency Management. We do have a handout that came in late, but it should be available to you. So as part of our regular updates, we always start with response. We do have an ongoing cold weather event that the OEM is supporting. As part of that, we continue to monitor any hazardous weather and support the policy group as they push forward through the emergency declaration, and did some coordination with voluntary organizations that are active in disaster as well, just in case there were unmet needs that they could support. A lot of public information amplification with the different complexities of the event. The declaration, any of the resources being provided, and then as well energy conservation messaging and the roof guidelines that the city put out. Moving on to preparedness for this past month. In light of everyone doing 2023 reviews, I pulled out a few highlights from the Office of Emergency Management from 2023. We had our first update in MOA code 3.80.010. This is the first update since the 80s, I understand. And the code was quite limited in that it had the office working just on planning, But as we've demonstrated over the last 5 years or so, we are in fact working in response, working in recovery, doing mitigation as well. So the code has been updated to support that work that we're already demonstrating. The second thing that we wanted to highlight for 2023 is our 5-year update to our city's emergency operations plan with the different lessons learned and changes that we've had in our operations as a city. The third thing is a geospatial roadmap for public safety. We included several departments and integrated existing information related to location, and also put forward a roadmap for improving that analysis through all hazard dashboards. So that was a big project that we worked on together. The tsunami study that you all have been briefed several times and participated in our outreach program confirmed that Anchorage does have a tsunami hazard within our jurisdiction, and we did quite a bit of outreach on that. We also updated our continuity of operations planning guidance for the departments and did workshops to help them get their department continuity of operations plans up to date. A significant note is that pre-2018 earthquake, the Office of Emergency Management was running 2 grant programs. We are now running 6 grant programs out of our office. Everything from new roofs and recovery actions and permanent work from the disasters, debris removal, things like that, emergency work in the disasters, to buying cybersecurity equipment and drones for the police department run through those grant programs. So it's a lot of work, but it's really the how of how we get all of this done. A big project under recovery is our after action report and improvement planning for COVID-19. I've heard in several different public discussions about who is cataloging and putting together improvement plans from that disaster. So our data call has been complete with incident action plans, thousands of resource requests, and public information documented from that disaster. We've also initiated outreach, including responders, the business community, other partners that helped us. And those surveys can be reached at the OEM website under recovery. And then the big item that I wanted to give you a chance to talk to a program manager, Sean McKenzie, about is our full-scale exercise Alaska X coming up in March during this meeting. And just give him a chance to make sure that that everyone understands that that event is scheduled in March. Go ahead, Sean.
Yeah, thanks, Dr. Roach. And like the director said, my name's Sean McKenzie. I'm one of the emergency program managers at the Office of Emergency Management. So it's a pleasure to be here today. Back in January, Director Loach talked to you about our large full-scale exercise called Alaska X. It's planned for the week of March 4th. And I wanted to update you that since that time, plans have continued to progress. As a reminder, Alaska X is a regional exercise that's being conducted in Anchorage, Cordova, Valdez, and Kenai with the state of Alaska Department of Homeland Security and Emergency Management. For Anchorage, Alaska X will exercise emergency management and coordination between the municipality and our partners. Following a simulated 9.2 magnitude earthquake, the Anchorage Emergency Operations Center, also known as the EOC, will be activated. As you may already know, the EOC will be staffed not only with personnel from the Office of Emergency Management, but also other Muni employees who have agreed to serve in the EOC during time of emergency. As Director Loach reported last meeting, the team will be exercising and evaluating multiple core capabilities, including public information and warning, operational coordination and communication, situational assessment, search and rescue, and mass care. I'd like to highlight 2 items which may be of interest to the committee. First, the municipality will be testing a new damage assessment app called Quick Capture. This will involve a small group of frontline responders taking pictures of simulated damaged buildings on their work cell phones, categorizing the damage, and then transmitting the images through Quick Capture app to a Muni Public Safety dashboard, which can be accessed by the Emergency Operations Center, the other public safety departments, and any other municipal department which needs access. The other item to highlight during this exercise is that Anchorage will ask the state of Alaska for assistance with urban search and rescue. At the state's request, a 20-person National Guard team from California and approximately 10 National Guard members from JBEAR will assist the Anchorage Fire Department in conducting urban search and rescue. Not only will this be an excellent opportunity to work with the National Guard, but will also exercise the ability to request external support in the event that the resources of Anchorage are overwhelmed during a large-scale disaster. Finally, an important component of this exercise is the after-action report and improvement plan. In the month following the exercise, Office of Emergency Management, with the assistance of a contractor, will be compiling the results of our exercise evaluations and feedback from exercise participants. This information will be used to continue to make improvements to the readiness of Anchorage to manage disasters. Subject to any questions, this concludes my update on Alaska X.
Doesn't look like we have questions. I have one. Can you give us a sense? Does the role of you mentioned that there are municipal employees that are going to be involved in this. Can you give us a sense of what we would expect? Some of us in terms of City Hall and residents. What will folks see? Will folks see things happening during this period of time?
Yes, and just to clarify, what will folks see in terms of the public and in terms of
Yes,
leadership at the municipality?
Both, yes.
Yeah, both. Excellent question. For the exercise, it is interesting to ask what will be simulated, released to the public, and what will be actually released. So we do have a public information component to this drill, but that will be making a press release, doing a mock interview, all these type of things that a public information campaign would do. But the expectation or the plan would be to not actually have that be released to the public. Right. That would be the thought. In terms of updates to the assembly or to the administration, again, we have a process called the policy group where we would provide that information. And I think at this time, the plan was to be simulating, providing that information, preparing it, but then simulating, providing it. And then there's still a little discussion with the administration if they would like to do some type of release to the public that the exercise is going to happen. There's actually a National Guard. This is in conjunction, if you've heard of Vigilant Guard, which is happening at the same time, where the federal government is also in this same time period doing a disaster response exercise. There's going to be a press release talking about that the exercise is going to happen. But then the actual exercise, I think most of the things that we're doing, we're talking about simulating that release to the public, not actually releasing it.
Okay, thanks. That's very helpful. So most of us won't know it's happening when it's happening, is what you're saying.
Other than the press reporting to you that it's happening
Right.
in advance, just in case you were to see, extra emergency response vehicles staging, getting ready to do whatever components they will be doing in real life.
Okay, thanks. Yes, Ms. Braga.
Well, it just seems like in light of the last quake where people ran outside and did all the wrong things, like, having like the moment that this 9.2 announced and we kind of do a shakeout drill of what we're supposed to do right might be a good idea, but.
Yep. Okay. Well, thanks so much for your presentation today. We really appreciate it. I think with no other comments, we'll move to audience participation. Is there anyone in the room who'd like to participate? Ma'am, would you like to come up and speak? Okay. Travis, if you would give her a microphone, and you'll have 3 minutes to speak. If you could start by introducing yourself, and I'll give you a timer when your time's up.
Is it okay if I prefer to stand?
Sure, that's more, you're more than welcome to. Just push the button there, and you'll see the green light come on.
Understood. I haven't started quite yet. I just wanted to let you know
Yep.
that it's going to seem a bit impersonal because I've run out of time before. So I'm actually going to read something I've pre-prepared. Okay?
Okay.
First of all, my name is Miss.
Ma'am, if you just turn on the there
Now
you
it's
go.
green.
Yeah,
Okay.
that's green.
Sorry about that. First of all, my name is Miss Sophia O'Neill, and I reside and now have a residence in Eagle River. I do not belong, nor do I represent an organization or agency, government or private. I'm here before you to share information. Finding myself with the opportunity and will to observe and learn finite aspects of criminology, I came across something which I wish to share. From October 22nd of last year until January of this year, I witnessed firsthand an aspect that contributes considerably to the funding of criminal activities. The open theft of local businesses for organized crime is blatantly obvious, but worse is when considerable evidence of the fact is presented by their own internal audit, hired security, their own employees, or even members of the public, including myself. The choice ends up being inaction. I personally have had multiple discussions with people in charge to be told that insurance covers $500 to $1,500 a day in the theft that occurs, in internal and external theft. Sorry. Also, that to address such issues with intervention creates liability to perhaps a greater proportion. So it is not done. Both security and employees are under strict policies to not interfere. Policies are sometimes called charges, are not followed through. Though only warnings, I'm so sorry, I'm having trouble seeing this. Policies are sometimes called. Charges are not followed through, only warnings to thieves of a do not trespass, which are not enforced actually due to the do not approach policies. When policies such as this are in place, just with any illegal activity done for financial gain, it funds further criminal activity. The hands-off approach is well known and absolutely detrimental in the long term, and it wastes the time and resources of officers. It is important to note that police are more often than not called, and when they are called, they are basically simply used as a deterrent without these corporations, these stores, follow through. Prosecution by stores not followed through by prosecution. The time of officers is in fact wasted. The response, their response is fruitless, and the public does see it getting worse and offers the blame to officers when responsibility clearly is in the hands of the business owners. When I presented to those in charge at this varied businesses without oversight, the choice of inaction is often made for them. I'm told because with insurance, there is no loss to them. Thus, the community suffers via their safety, higher prices, and hours or positions of their current employees. I want you to know that I am sorry for my trepidation, that my voice is a little bit shaky. I feel very strongly about this subject matter, and oftentimes it's actually better for me to speak than to try to read. I just hope that attention is given to the fact that I, for one, do see officers respond. I do see officers do their duty to only be undermined by the lack of prosecution and follow through. So the officer's time and management is fruitless. And the public will so often attack and make comments about the officers not doing their job, when you have to look at the actual source of what's going on and what this domino effect causes.
Ma'am, thank you. Your time is up. But
I'm so sorry.
no,
I
it's
didn't
okay.
hear.
No, it's okay. It was a very small chime, so I
Okay.
just I wanted to make sure. But if are you finished?
I'm finished.
Okay.
I just wanted to sum up.
Thanks very much for
So
your
I
time.
apologize.
Yep,
And
no.
thank you for hearing me.
Thank you for your testimony. We really appreciate it. Is there anybody else in the audience who'd like to speak at this time? Okay, Travis, do we have anybody online? Is there anybody online who'd like to speak at this time? If you'd like to hit *6 and make yourself known, now is the time for you to speak. So I'll pause and see if anybody unmutes and would like to speak. Okay, hearing none. Is there any additional business we need to do? Okay, yes, Ms. Brawley?
Yeah, I did not want to bring this up in detail today, but I just wanted to follow up on the conversation that we had in one of our prior regular assembly meetings around the Public Safety Advisory Commission. So I didn't ask to be on the agenda today, but I just wanted to note that I'm hoping in March we can start that conversation. And then I want to check in with Cameron and others about what that could look like, because I think it'll take a while and we want to be intentional with that, but just to state the intent today. Thanks.
Yeah, I'd really like to get that on the agenda so that we can begin to plan for that. Thanks for bringing that up and adding that to the record. Okay, seeing no additional business, this meeting is adjourned. Thank you, everybody. Have a good day.